Welcome. We're continuing our series of getting to know our faculty, and we're really thrilled to be talking with today Dr. Christian Kastrup. Christian joined our division of trauma and acute care surgery a number of months ago, and Christian will correct me in the exact date. And is a PhD scientist working predominantly in the Blood Research Institute, so-called BRI, one of the large research institutes on this campus. Christian, thanks so much for joining me today. Thanks for joining the Department of Surgery. And maybe we can start by home. Where is home? Where did you grow up? I'm going to eventually get to the University of New Hampshire because that's a little close to where I grew up, but take it away.
Oh, thanks. Yeah, thank you very much for talking with me today, and of course for letting me become a member of the department. So yeah, I've been really happy since being here in September. Yeah. But I grew up near Rochester, New York. So it's about an hour from there in a apple farming community on Lake Ontario. And yeah, so from there, yeah, after working on apple farms and having a passion for that, I started in plant biology at the University of New Hampshire. Yeah. So
that was the attraction to the University of New Hampshire.
Right.
Oh,
exactly.
Wow. Well, I have to give a little shout out to my grandmother on my dad's side, my paternal grandmother, who for many years was the youngest woman graduate of the University of New Hampshire. Wow. So yeah, you can imagine this goes back a long ways, but really an amazing story. Her life was an amazing story. But anyway, go ahead. So you migrated a little bit away from plant biology at UNH. What happened?
Right. Yeah. Well, I took a chemistry class, and most people were pretty bored by it, but I liked it a lot. So I figured if I liked it so much, that's what I should focus on. And so yeah, so I switched to chemistry and organic chemistry, and then went to did my PhD in organic chemistry at the University of Chicago.
Now I want you to know that gives a lot of current doctors a little bit of indigestion, that organic chemistry. But
yeah. No,
but you loved it.
Yeah, I loved it, and I had a lot of fun, training. Even then, training future clinicians, how to push arrows and do organic chemistry.
So where did life take you after UNH?
Yeah, so I did a PhD in a blood coagulation lab at the University of Chicago. Yeah. And so yeah, that's where I formed a passion for blood clotting and controlling blood clotting, and really saw the potential for impacting hemorrhage and hemorrhage control, and trauma patients with hemorrhage with severe hemorrhage.
Oh, absolutely. And if you think a minute about organic chemistries and all those crazy pathways that would keep me up late at night, and blood coagulation, there's a lot of similarities there. There are all these just as you said, arrows, all these arrows going everywhere in both those fields.
Right. Yeah. No, it's true. Yeah. Yeah, coagulation can be pretty intimidating for most people, but yeah, worked really hard to learn all those arrows too.
Oh yeah.
Yeah, I formed a real passion for it. Yep.
Yeah. Where do you, if you had to explain to the people who may be watching this video, and one of the things that there are a number of reasons why we were so excited about your recruitment, but one of them was the translational aspect of your research, which is really neat, because in medicine, and especially in surgery, we deal with both ends of the problem. We have bleeding on one end, and we have inappropriate clotting on the other. So maybe a couple minutes on where you think on the focus of your laboratory, and then where you think that's going to impact society.
Yeah, thanks. Right, and so so a portion of my lab focuses on basic biochemistry of coagulation, but we try to use all of that knowledge to create therapies both to control bleeding and thrombosis. And so as our bodies, when we're injured, we're always trying to form clots to stop any leakages. And so, but on the other hand, there's a high susceptibility that our blood coagulation system can become overactive and form thrombi and include blood vessels. And so so we study how those processes are regulated, and then as I mentioned, tried to create technologies to control them. And so we do that both for for bleeding and hemorrhage control, as well as thrombosis. Some of the things that we're doing in hemorrhage control are really geared toward trying to stop like the biggest, baddest bleeds. I mean, paper cuts, easy to put pressure on them, put a Band-Aid, lots of things there. But for the worst types of bleeds, like severe bleeding in the abdomen, for example, or if there's a severe bleeding situation and the person for some reason can't get to a surgeon fast enough.
Sure.
Those are really really dangerous situations that have high mortality, and so yeah, we try to come
both in the military arena and unfortunately in our urban environments where penetrating trauma is a challenge, right?
Yep. Yeah, that's right. Yeah, we focus a lot on military, but it's widely applicable to a wide variety of civilian situations.
Sure. Yeah. So, and what are the, maybe without giving any trade secrets away, what are a couple of the areas that you think you may be able to have an impact on, if we take just bleeding for a minute?
Mm-hmm. Yeah, so I can tell you about some of the things that we're developing for non-compressible abdominal hemorrhage, and this can be penetrating injuries to the abdomen or blunt force injuries to the abdomen, and these are common in combat, but in car accidents and a wide variety of trauma. And so one of the things they're developing there is a way to deliver hemostatic agents, so materials that clot blood, deliver them into the abdomen. And so we have devices that can, through a non-invasive or with a low amount of invasion, put the device and the powder that is very hemostatic into the abdomen and to spread throughout the abdomen to stop those bleeds. And so that can buy time for a person, so they can reach surgery, and we think it can be applicable for surgical situations as well. Yeah. So that's one of the things they're developing, and another one is to try to enhance blood products. So blood products like platelet transfusions are used for controlling bleeding, controlling hemorrhage, and so we're trying to enhance platelets to make them even more effective.
Wow.
And so we use genetic approaches, gene therapy and RNA therapy-based approaches to do that.
So you'd want to be able to turn those platelets on, but then turn them off again when the person wasn't bleeding, right?
Right. That's right. Yeah.
So I know we don't have too much time here. Or Haley's going to turn the camera off on us, but so how would you do that? Because many of us struggle with the other problem that platelets are too sticky and they cause too many clots. Mm-hmm.
Right. Well, yeah. Thrombosis after post-traumatic thrombosis is a huge problem, and our platelet technology isn't geared towards that one. So yeah, for the platelets, we're trying to make them more responsive, and
so they would be platelets you would probably transfuse into the person.
Exactly.
Yeah. Wow. Super sticky platelets.
That's right.
Yeah. Wow. Fascinating. Dr. Christian Kastrup, thank you so much, Christian. Last couple questions. What do you do outside of work?
I spend time with my two daughters, and the favorite thing that we like to do is to fish. So we fly fish for trout, and they've been doing.
How old are they now?
They're 7 and 11. But
oh wow! So the real test will be in another 4 or 5 years. So they still want to go fly fishing with Dad? Right.
Yeah. Or in the 5 years after that, hopefully they'll come back and enjoy it. But I had them started in the backpack when they were babies. So
Oh, that's neat. So where do you go fly fishing?
At the moment in the tributaries of Lake Michigan.
Yeah.
But really looking forward to exploring more of Wisconsin, like the driftless area. So really look forward to taking them there.
And it's so much better than Illinois, don't you think?
Yeah.
Yeah, no question.
Right.
Yeah. Well, Christian, thanks so much. Really great to catch up with you, and we're so glad you're here.
Thank you.
Okay. Thanks.